Hi everyone, and welcome back to Excellence Noir, where we seek to raise the standard and change the status quo. Today I will be sharing my story for you on how I became a nurse. And at the end of the video, I will be sharing advantages and disadvantages of becoming a nurse based on my personal experience. So let us get right into it. So, a very long time ago, there was this little girl who was watching a movie about an athlete who used to run marathons, like very long marathons, and to raise money for, I think it was a charity. And at the end of the movie, I think he got some type of cancer, but it was a very long time ago. So I'm not sure the name of the movie. I tried to research it, but if you do know the movie, you could let me know in the comment section. But I was watching this movie of this man who was an athlete, and he used to raise funds for charities by running. And in the middle of the movie, I think he got cancer and he couldn't run again. And then I think at the end of the movie, they did write that he died. So he never really recovered. And I remember being this little girl and thinking, oh, I need to be a doctor. I need to save people's lives. I need to help somebody. So that is where I first really got that desire to save people or to help people. That was, I think I was about 9 years old when I saw that movie. And from watching that movie, I knew that I really wanted to work in healthcare. So during my secondary school days, I really focused all my energies on the sciences and also really putting in the work because I really wanted good grades because I knew that I was aiming to get a scholarship of any sort because I was not really well off or financially stable. So I wanted to get a scholarship. So I really focused my energy on the sciences. Then after secondary school, I applied for this medical school and I planned on doing the pre-med program to transition into the program. And while I was there, one of the lecturers spoke to me and she was telling me that the school is not really accredited as yet. And if I am interested in becoming a doctor and working in medicine, then probably I should try the nursing program first. And from there, I can move into medicine. So I was like, okay, you know what? Let me give it a go. So I got into nursing, and then during the program, when we really got into our clinicals and we started going to the hospital and going into the clinical setting, I really I was fascinated by it. And at that point, I still felt like, okay, probably I would have gone into medicine, but there was something about nursing that stood out for me. The interaction between the nurse and the patient, I kind of felt like that is what I was looking for because as a Christian, I always wanted a job where I could help people and serve people and really feel like I'm doing something. So I felt like with medicine and being a doctor, yes, you felt like when you watch the movies and when you watch the shows, you feel like, yes, the doctors come in and they save the day and whatever, and the patients and the doctors are so. But when I really got into the practical aspect of nursing, going to the hospital, I saw that the nurses spent most of the times with the patients. So you really get that interaction with them. And then I realized that is what I wanted. I wanted to be there with the patients. I wanted to be there and make somebody laugh and make a cup of tea and listen to their stories. And, so when I really got that experience in the practical, in the clinical area, I was like, okay, you know what? I think I will. Yeah, I think that's it. I think that's what I'm looking for. And so I decided to stick with nursing. And up to a day like today, I have not regretted that. And I am so grateful that I have this experience. Although some days I'm like, and then I have some days where I really, really feel so blessed and I feel so grateful that I have the opportunity to impact people and to help people and to make them feel better. So after all of that, I completed my nursing program and then I successfully completed the regional exam, which allows you to be a qualified nurse. So a few months after that, I still did not get a job. The first job I got was at a call center, which was like a suicide hotline. And it was really eye-opening for me because I had never really realized that in my country there was a call center that people who was feeling suicidal or depressed could call. So it was really a good experience for me working there. It really wasn't, the nursing that I had studied, but I was still getting that interaction with individuals, which was good. And sometimes we would still assist on the mental health units, so that was fine as well. And then I got a call to work at the main hospital. And imagine when they called me, they said that they have a position, and it was 3 of us that day, and it would be in intensive care. Excuse me? Yeah, so when I was like, you know what, forget it, I'll just be unemployed. And then I was like, okay, you know what? Like, you don't back down. When you have challenges, you don't back down. So I was like, okay, I'll come and I'll do my best. And that was an experience, let me tell you. Like, you as a nursing student, you're used to people being awake and speaking and all of that, and we did not get rotated into intensive care. So it was like really my first time being there and seeing patients and all of these machines and all of these sounds and all the alarms. It was just a lot. And coming to think of it now, like, give me the machines. Right now, I'm like, give me the machines, give me the GCS free on 15, like, that's it. But initially, when I got there, it was really intimidating. You feel like you will never learn all of that, and it was just too much. But the type of support, the amount of support I got from the doctors, the nurses, my managers, and all of that, I really got into the hang of things, and that was a really good experience for me. And I started working, that was in 2016. I started working in intensive care at the hospital, and then I left last year, 2019. So I worked there about 3 years. So I left 2019 and I started working in the UK in June of 2019. So I left my previous job in May 2019 and I started working here in June 2019. And I also got a job here in an intensive care unit. And you remember when I told you when I just started nursing and they told me I would have been in intensive care, I was like, what? Well, when I came here, I was already used to patients like that. I was already used to machines and all of that. And I was still there like, what? Because all the machines were different. Everything was different. The whole system and the protocols and all of that of the hospital was really different from what I was used to. And I really felt like, honestly, I was feeling very anxious, like, oh my God, I will never be able to do all of that and learn all of that. And now it's been a year that I've been here, and I look back and I've grown so much and I've learned so much. And the support that I've gotten from my senior staff and my managers has been so great. Everybody keeps checking on you, making sure you get your stuff done, making sure they explain stuff to you. And so definitely the year was good. Things were coming along nicely. And then who walked in? The corona came in and destroyed the rest of the year. But still looking back during that pandemic, where I really had to, I really pushed myself because we had to have more patients than we were used to. I can see how much I've grown and how much I learned during that time. And comparing myself like a year ago, I can definitely see how much I have become more competent and I've become more assertive as a nurse and really know what I'm about, and I'm able to be an advocate for the patient. So that is my little story on how I became a nurse and how I started working in the United Kingdom. And I will be making a separate video about the whole process, how I really applied and got through with the job in the United Kingdom. I will be doing a separate video for that. But also, I just want to leave with you before I go 3 advantages and disadvantages of becoming a nurse. And these are for all of my nursing students. So the first advantage that I would say is that nursing is a very esteemed career in most parts of the world. It's a career that you can be proud of. It's really something that will give you stability. So definitely I would say that that is an advantage of nursing, that wherever you go in the world, it's a very esteemed career. And the second advantage that I would say is that because it's a very esteemed career, you know that in most parts of the world that it pays well. And I like the fact that as long as you've really studied and qualified, even if you have a few exams to do, you can go to almost anywhere in the world and look for a nursing job, because, which is not a good thing, there's always a shortage. So you can really like go move to any part of the world and get a nursing job. And in most parts of the world, nurses get a good enough salary. So it's a job where you can get a good enough salary. So the third advantage I would say of being a nurse is the feeling that you get. And I feel like that's something I can't even really put in words. I think when you're a nurse and you've had that experience, you know it. When that little elderly lady says, "Oh, thank you, my dear. Oh, God bless you." Or you get that little smile, or you see that one patient get to go home and they come back and say hello, or, so like on your way home, you really feel something, like you just so, oh wow, you happy, you feel that joy, you feel that sense of accomplishment. And I feel like that is something that really keeps you going, because nursing can be stressful, but when you have those days where you did all what you had to do and you helped somebody and you really saved somebody's life, you saw that the fact that you did something in time, the fact that you recognized signs, the fact that you escalated something in time, and so you prevented something that could have really, the patient could have deteriorated, and you saw it in time, you really go home with that sense of accomplishment, and it really keeps you going. And the disadvantages that I would say of becoming a nurse would just be 3 of them based on my personal experience. Is that it's very stressful. It's very stressful because you're dealing with people's lives. So it can be very stressful because there are you're trying to avoid making mistakes. You don't want to make any errors, but at the same time, you feel like you're human. And then you feel the stress of like really trying to be perfect and making sure you do things perfectly so that you don't cause any harm to anybody. And so it can be really, really stressful sometimes. And you really go home some days and wonder if you forgot to do something, if you forgot to sign something, if sometimes I would wake up in the night and be like, oh my goodness, I forgot to say that to the nurse, or I forgot so it can be really stressful. So I feel like if you're planning on becoming a nurse, you really need to think about how you manage stress. Sometimes, some days you have those, some days you just really have like those days where you want to cry. And I've had those days where I cried, like after the shift, I just cried. I was just, yeah, it was just too much. But then, you have the good days and then you get the strength to continue. The second disadvantage I would say would be staff shortage. And I feel like wherever you go in the world, there will always be a shortage of nurses. And you really feel the pressure. You feel the pressure, you feel the stress when there are not enough nurses on the shift. You feel the stress, and you're required to do more than you would have usually done. And so you feel like you've been stretched thin. But staff shortages is really something that you need to prepare yourself for, that there will be days where there will not be enough people on the team. But if you definitely become a team player and everybody else is a team player and you're working together, you usually get the work done in time, everybody gets to go home, and the patients are safe. And the third disadvantage that I would say of becoming a nurse is the fact that really the way your schedules are and missing holidays, it's something that really is tough, and you get used to it in time. But initially, when you just become a nurse, you realize you're missing all of the parties, all the weddings, and all of the nice little weekends and movie nights, and you're really not home as much as you expected to be. And especially if you do night shifts and stuff like that, you really notice that you miss time with your family, you miss time with your friends, you miss a lot of occasions. But I have noticed that, in the career, they're really putting a lot of effort to get people to get holidays with their families. So, you can choose between Christmas and New Year's and stuff like that. You could swap shifts with your coworkers, but it's something as well that you need to be mindful of, that there will be days that you will miss special occasions and you will really feel bad about it and all of that. But overall, I'm telling you, that feeling that you get if you're somebody who really loves helping people and you care about people and you're into sciences and stuff, that feeling that you get as a nurse when you have helped somebody and when you're part of a team that has saved somebody's life. And so that's why I would say, for me, that is one of the best decisions I made when I decided to become a nurse. So anyways, guys, after me doing all of that talking, I hope that you did enjoy the video and that you share with your friends and that you stay tuned. Make sure you like, share, comment, subscribe, and make sure you touch that notification bell at the bottom, the little bell at the bottom. Click that bell so that you're notified every time I drop a new video, so you don't miss any videos. So thank you guys for tuning in, and do enjoy the rest of your day.